So I'm going to do a presentation on a school-based mental health program for improved knowledge, access, and uptake of mental health services, a case study of Kisumu County. And I presenting is Whitney Demo. I'm a counseling psychologist and also a mental health peer educator at Tinada Youth Organization. Yes, so at the end of my presentation, you are going to be able to recognize the unmet needs of the primary, secondary, and tertiary prevention of mental health for children and adolescents. We are also going to be able to understand the components of school-based mental health intervention under the program of Imarisha. And we are also going to acknowledge the challenges that we have realized under this program. So, just to introduce us to the program that led us to start a school mental health-based intervention. From the word Imarisha, it means to strengthen. And it is a program, it is a 42-month project that began in May 2020 and will end in October 2023. That is a 3.5-year program that is being implemented in Kisumu County, that is funded by Comic Relief and UK. And we're also being supported, we also work in collaboration with the county government because there's no way we work minus them as a civil society organization. And the project contributes to improving mental health and well-being in Kenya. And it focuses on persons with or at risk of mental health condition and psychosocial disabilities. And our core target, we work in school and also out of school because when you're looking at the youth, not all the youth are in school. So we work with primary and secondary schools. So in the schools, we also focus on special schools as part of our program. We also work in the tertiary institutions. When it comes to out of schools, we target the male who are out of school and the teen and single moms. Because as I've mentioned, we are working with people who are with or at risk of mental health conditions. So this project, we have our expected outcome, whereby we hope that communities will have improved knowledge on mental health conditions, not just general, and also be in a position to distinguish, because this has been a problem, what is mental health, mental illness, and mental well-being. And also be in a position to ensure that there is improved mental health systems. And earlier on, Dr. Rick had presented something on the government working on sustaining the health systems that exist. And also we also will ensure that there is improved access and uptake of mental health services. So why did we decide to do this program? When you look at the prevalence, I'll not focus much on it because other presenters had mentioned on it. When you look globally, the 13.4% of children and adolescents are affected. And when we narrow down this in Kenya, we realize that the figures are 3 times higher. And we need to ask ourselves why. And that is why, as an organization, there's a research we had done back then in 2019, and from the findings, and in collaboration with other people, we designed to do this program to see if we can address some of the issues and also identify some of the gaps so that in the future, other partners can also come to assist filling these gaps. So, this program, as it was implemented, it is being carried out by peer educators who have been trained on mental health, and also in assistance with the resident psychologists at the office. And we usually go to schools, and when we get to schools, we collaborate with the guidance and counseling teachers, whereby after we introduce the program, we go ahead and do an outreach for the whole school, tell them why we are here, why we are doing this, and also tell them the services that we are going to provide while there with them. And after that, we form a mental health club that consists of 30 students. Despite the number of students in the school, we only pick 30 students who either have or are at risk of mental health. And for those who will not fall in the club, but they also have unmet needs, we also offer one-on-one sessions because, as I say, it is a funded program. And for the counselors in the room, you know how expensive it is to always have a session, and not all Kenyans can afford this. So under this program, we offer the sessions free of charge, pro bono for this time. Yes, so we offer one-on-one services, and for those that are beyond us, we refer to hospital, other organization for other interventions. And even as they continue with the treatment, they are referred back to us because, as we know, treatment comprises of various components. So there is internal therapy and also external therapy. And when we go into schools, first and foremost, we usually conduct a baseline survey just to get a preview of how much knowledge they have based on mental health, because, as we say, it's a program and it's still a pilot program. So the findings we get from this will help us to design other projects and implement them in other areas. So we do a baseline survey, then we conduct 8 sessions with them that runs for 8 weeks, and then we also do an endline survey just to see the impact of the program that we've done, how much it has been of help. So we have like 5 topics that we now break down into 8, and even as we do this, there are some of those students who will have come for a session, but then being in this club, there is a way we also support them. Like, for example, when we help them to explore their mental health and well-being, the basic thing we're doing there is psychoeducation. When we help them to identify their social support and the various challenges to their mental health, we're offering them supported psychotherapy that they will have come one-on-one, but now we are meeting them as a group. We also do mental health and well-being in our schools. We help them to identify their mental health challenges and how to maintain their mental well-being in school. And this we focus on the pandemic because we realize it is something that brought out a very huge gap that has been existing, just that we never realized that it was an issue. And we help them to identify and manage their feelings and expectations. And this one, we train them on rational emotional behavior. And we also teach them to develop positive health-seeking behavior and being hopeful for the future. So when we go to schools, as you see there is a picture, we as an organization, I think there is a presenter earlier who had talked about having manuals for teachers, parents, and all that. As an organization, in collaboration with the psychologists, the psychiatrists at the referral hospitals and other stakeholders, we developed a toolkit that we usually use for the school clubs and also for the other out-of-school programs. Now, just having a little snippet of what we've done. So far, we've engaged 1,113 students within Kisumu County, 500 who are male, 601 are female, and out of the number, 98 were persons with disability. So when I talk about persons with disability, this includes visual, hearing, speech. It also includes intellectual and learning disabilities, the psychosocial disabilities that we are talking about. Now, just a preliminary qualitative reflection. Before we started this program, as we've said, there wasn't much information on mental health that was being done. So even us, before we go through training, there are those myths and misconceptions and assumptions that we used to operate on. So right now, we see that students, they are well informed on mental health. Therefore, they are empowered to stand for themselves and also be in a position to also help other members of the school and the community. We also see that long time ago, mental health conversations were taboo. But right now, with also the other interventions we do not only in school but even in the community, mental health conversations are now more normalized and welcome. And schools were not referring students to mental health practitioners because they didn't even know this is an issue. Who do I take this child to? The stigma issues. But right now there is comparatively high referral and uptake of mental health services, like 14.5% out of the survey we did of clients are being referred by schools. An outlook. It's important for us in this forum to continue finding ways to collaborate with counseling, with guidance and counseling teachers, and equip them with additional counseling because we know in our schools, not all teachers are trained. So some of them, they're just doing it out of passion, but also lacking the skills. Sometimes they might be worsening the situation instead of helping. And then also, we need to continue holding mental health sessions with students and continue to create safe spaces where mental health conversations are normalized. It's important for us to start employing professional counselors in school because you can imagine I'm a student, it's my mathematics teacher whom I'm at crossroads with, and at the same time, it's a teacher who is also a friend to my parent, and I want to go there and share that teacher so-and-so did this and this to me, or my parent is doing this and this to me and it's affecting me in this way. There is no way a student like that will do. And therefore, at the end of the day, they go with unmet needs and they end up doing other stuff. And then we also need to integrate mental health programs in our curriculum because as we are here, there are people who are doing preventive and promotive aspects in terms of mental health. There are those who are doing treatment. So integrating mental health program will be very important. Creating safe spaces for our children, especially in the community, especially when the community, home, or the environment around them isn't supportive. And also establish ways of how to incorporate parents to ensure that there is effective success of what we're implementing. Because what is the need of us teaching students and these things that we're teaching them? Sometimes when we do these trainings in school, the teachers, they don't attend the training because you go there, they give you the students because they also have other targets to meet, just like their fellow teachers. So number one, they're not attending the sessions. You've taught the students. After this, they get to class, they want to implement what they've been taught, they want to help themselves, but then these teachers, they have no idea of what you've taken them through. When they get back home, maybe there is also where the issues are coming in. And sometimes we are having even issues of doing this because of consent issues. And at the end of the day, even as we are doing this, there's still other gaps that exist. So we need to establish ways of how to bring in teachers and parents. It is upon us to stop having like a fixed upper limit number when it comes, like for instance, those who are doing activities with adolescent and youth. I know we have targets and all that. And sometimes this is also preventing us from reaching a number of people. Like for instance, there's a way this program has been designed. And there are other people who also need the program, but due to limitations, we can't reach out to them. So out of this presentation, I hope other stakeholders who are also here will be in a position to find ways of how to do this in the various areas where they are, or find ways to support us to extend this. Our takeaway message from the presentation is that schools play a critical role in the promotion of mental health and wellness in the community, and outcomes of mental health in learning institutions have been strengthened by empowering teachers and reducing stigma and discrimination.